Hair loss can be a significant concern for many individuals, as it can affect their self-confidence and overall well-being. Fortunately, cutting-edge hair restoration solutions like Follicular Unit Extraction, or FUE, hair transplants provide a natural-looking, permanent way to restore hair. However, the success of this procedure hinges not only on the surgery itself, but also on the recovery process that follows. Here, we explore the essential aspects of the FUE hair transplant recovery timeline to guide you through the journey to fuller, thicker hair. So let's start with immediately post-procedure, the first 24 to 48 hours. Immediately after your FUE hair transplant procedure, your scalp may feel tender and you might experience a mild discomfort. During this period, it's normal to experience some swelling and redness in the treated area. However, these symptoms typically subside within a few days. You will also have a bandage around your head. You will keep that bandage on for 48 hours. You do not want to touch any area that the hairs have been transplanted. Leave them open to air. Do not worry about washing or touching them at this time. You will be prescribed pain medications and antibiotics to prevent infection and manage any discomfort. For the first few days following the procedure, it's crucial to rest and avoid strenuous activities to allow your body to heal properly. Refrain from touching or scratching the transplanted area to prevent dislodging of the grafts. Now let's move to days 2 through 7, the initial healing process. As you progress through the first week of recovery, you may notice scabbing forming around the transplanted grafts. This is a natural part of the healing process as the body works to protect the newly transplanted follicles. It's essential to follow your surgeon's instructions regarding washing and caring for your scalp to ensure proper healing. We will recommend gentle washing of the scalp using a mild baby shampoo to keep the area clean and promote healing. However, it's crucial to avoid any type of rubbing or scratching. What we're going to want you to do is put water and baby soap in a cup and pour it over the area of the scalp that has not received any type of follicles. For example, if we do the front of the head, pour the water over the back of the head and allow it to flow through the front. Then rinse it using that same cup. You also want to protect your scalp from direct sunlight. It is vital during this phase to prevent any sunburns or potential damage to the newly transplanted follicles. Always wear a hat when outdoors. However, do not put any sunscreen or anything else on the scalp directly during those first 2 weeks. It's important to be patient during the initial healing phase and refrain from picking at the scabs or attempting to remove them prematurely. Allow the scabs to fall off naturally as the underlying skin heals. At 14 days or 2 weeks after the transplantation, you can scrub the rest of the scabs out, wash your hair, and get a haircut. As you enter the 2nd to 4th weeks of recovery, you may notice some shedding of the transplanted hair. This is normal, and it's part of the process known as shock loss, where the transplanted hairs enter a resting phase before regrowing. Don't be alarmed by this shedding. It is an essential and natural part of the hair growth. It's very normal for the transplanted hair to shed in the weeks following the procedure. However, remember that this is temporary and new hair growth will gradually emerge in the coming months. Continue to follow your surgeon's instructions for scalp care and avoid exposing the treatment area to any traumas or injury. Although the shedding phase may be discouraged, it's important to remain patient and optimistic about the outcome. Remember that the transplanted follicles are gradually reestablishing themselves and will begin to produce new permanent hair growth after that. Moving on to months 2 through 6, the early growth phase. As you progress into the 2nd to 6th months of recovery, you may start to notice signs of new hair growth emerging from the transplanted follicles. While the growth may initially be sparse and uneven, this is a positive indication that the transplanted hairs are taking root. Seeing new hair growth can be an exciting milestone in your FUE hair transplant journey. Take note of the progress and celebrate the positive changes taking place. Despite the emergence of new hair growth, it's essential to continue to care for your scalp as instructed by your surgeon. Proper maintenance and patience are key to ensuring the most optimal results. making sure that you are taking your after treatment medications to help thicken and maintain the hair, such as minoxidil, finasteride, or other hair vitamins, are vital. While significant progress may be visible during this phase, it's important to remember that hair growth is a gradual process. Continued growth and thickening of the transplanted hair can be expected in the months and years to come. Beyond 6 months, we get into the long-term results. You can expect to see continued improvement in the density and thickness of the transplanted hair. By this time, the majority of the transplanted follicles should have established themselves, resulting in a more natural and aesthetically pleasing appearance. As you reach the long-term phase of recovery, you can fully enjoy the results of your FUE hair transplant. Your new hairline will be more defined, and any areas of thinning or baldness will be significantly improved. While the transplanted hair is permanent, it's essential to practice good hair care habits to maintain the health and vitality of your scalp and hair follicles. Regular follow-up consultations with your surgeon are recommended to assess the progress of your hair growth and address any concerns. Understanding the FUE hair transplant recovery timeline is crucial for anyone considering this procedure. By following the recommended post-operative care instructions and being patient throughout the various stages of recovery, you can achieve optimal results and enjoy the benefits of fuller, thicker heads of hair. Don't believe me? Here's my before picture. That's right, I'm not only a physician and chief medical officer at Genesis, I'm also the first hair transplant patient. If this was a great video, like, subscribe it, share it with your friends who might be balding and need that hair transplant, and we are happy to help you out. Thank you, and we'll see you next time.